They've become part of everyday conversation, and the need for them has increased worldwide during COVID-19. Sioux News reporter Katie Koppel spoke to respiratory specialist at St. Luke's College to see how ventilators work.
COVID-19 is a respiratory illness, and one of its telltale symptoms is shortness of breath. But some fighting COVID-19 are put on ventilators to help them breathe.
That's the life support system that is supporting those patients breathing when they're unable to do so themselves, when they're not able to get enough oxygen into their lungs. The ventilators are what's the process and the machine that helps do that.
Iowa recently purchased 500 ventilators to have in stockpile.
Ventilators, we absolutely need those for a stockpile, but you also have to have the people that manage those ventilators.
The Respiratory Care program at St. Luke's College is studying ventilators now, and student Brooke Venema showed us how they worked.
So this is the CareScape ventilator. This is one of many ventilators that we've been studying this semester. This is the tubing. This is where the air goes to the patient and back to the ventilator.
The ventilators are connected to a test set of lungs that mimic breathing.
We can definitely see how to adjust the ventilator based on things that the patient is doing and different problems with patients.
The ventilators have to be programmed for the specific patient they're working on.
So it's very good to know what those parameters mean, not only for the patient, but what's happening in the lungs of the patient. You can't set the ventilator the same to patient, and that's why we have a whole semester dedicated to ventilators, because you have to know what's going on in the ventilators, and you also have to know how to set them from patient to patient.
Venema says this program helps prepare them for respiratory care with hands-on experience, especially during this time of COVID-19.
Not only are there so many different types of ventilators, there's so many different types of settings, and you have to know what that setting means and what that means for the patient to help that patient get better.
In Sioux City, Katie Koppel, Sioux News.
St. Luke's College has the only respiratory care program in Northwest Iowa. We will have more on their program Saturday on Sioux News at 10 right here on KMAG 14.